Well, it's a great pleasure for me today to once again be interviewing the great Dr. Walter Pierpaoli. And as I think many of you who are watching will know, Dr. Pierpaoli has published a great deal over many, many years, in fact decades of research, because of course he is a scientist as well as a doctor. And he has been a specialist in immunology, in circadian rhythms, in thermoregulation, in transferins, and of course in melatonin, which I'm sure many people watching will know him very well for. And now he's also a specialist in TRH, which is a very interesting molecule. And TRH, of course, stands for thyroid releasing hormone. And it's going to be today's subject. We're going to talk about TRH in Dr. Pierpaoli's patients. So, first of all, Dr. Pierpaoli, I'd like to wish you a good afternoon.
Thank you. Thank you very much. I'm delighted to be here again. And my first thought is that, which crosses my mind, is impossible. That this is an impossible task to convey.
We shall do our best.
What the TRH is, once again.
Of course.
But I will try.
Thank you so much. Thank you, Dr. Pierpaoli. So let's start, if we may, with a general question. What do you consider the principal uses of TRH to be? What are you using it for in your patients, please?
Well, after 23 years working with TRH, unexpectedly what I found in '89, I am considering the basic mechanism of TRH, because a variety of activities forced me to consider these molecules as a totally different one than I thought at the beginning. So I have noticed many activities of TRH in many pathologies, in many conditions with my patients. Before I was working, of course, for a very many years with mice. So what I learned on TRH derives from my experimental work with mice 20 years. And now that in the last 15 years I am busy with patients, so I'm confronted with the real stuff, suffering people, all kinds of pathologies. Cautiously, I was at the beginning trying to understand how TRH could be applied to the most common pathologies, let us say arteriosclerosis, cancer, autoimmune diseases, neurodegenerative diseases. And more or less, without entering into detail, I was testing in a different kind of patients, pathologies, having some answers. To the extent that the task of explaining what is TRH and the variety, the possibilities of application is endless. But so we should focus on the most common diseases.
Indeed.
Cancer, but especially in my view, the killer number one is arteriosclerosis, is cardiovascular diseases, because it affects about 60-70% of the population. Sooner or later, even if you are 90 or 100, generally you die of some heart failure, cardiovascular diseases, or ictus, whatever. So let us say the first killer can be considered to be important for evaluating the effect of TRH. And then what? If you apply TRH in these most common of the pathologies, cardiovascular diseases, the metabolic syndrome, which affects most of the population sooner or later, if you don't die earlier of cancer or other pathology, acute pathology, infectious diseases, is to see whether it can be applied for modifying the course of arteriosclerosis. For example, effect on the sugar in the blood, so in your glycemia increasing with age, type 2 diabetes. Type 2 diabetes is almost universal, taking drugs. So diabetes, type 2 diabetes, and then of course how we can affect the metabolic pathway reconstituting the capacity to burn fat. not to decrease the level of fat in your blood. Cholesterol, triglyceride, which is the lipid fats in your blood, which, like glycemia, expresses the decay of your own capacity to burn what you eat, to utilize sugar to produce energy. So your energy is decreasing, your blood shows increase in glycemia, in sugar, and in fats.
Yes.
So this is so typical of the metabolic syndrome.
Right.
I do believe that, according to my experience, what I saw in my patients suffering from these metabolic diseases typical of aging or not aging, because it depends also on your genetics, how you inherited this good or bad metabolism from your ancestors. So I can see that TRH is powerful contributing to reconstituting the physiological level of these components in our blood. So sugar, I think I would focus on sugar and lipids, because if you can modify the aging-related increase of these components, then you have won a huge battle. I do believe that TRH is a key element for understanding this the decrease of the metabolic pathway leading to what? To all the common diseases of aging. So before thinking of aging, let us anticipate or delay or even reverse the tendency to develop this decay of the metabolism,
Yes.
which you can very easily control with common blood test or even by checking your body temperature.
So there's a lot of things there, Dr. Pierpaoli. I mean, obviously cancer, autoimmunity, osteoporosis. I hope we can go into a little bit more detail into those individual ones shortly. Thank you so much. So that's fascinating, Dr. Pierpaoli, and obviously that I can see there could be enormous potential for TRH. But perhaps we could just focus on a few areas specifically for our viewers, especially viewers, of course, who will have some of these problems. So if we start perhaps with diabetes, what's a typical patient program for one of your diabetic patients, please?
Diabetes, type 1, type 2 diabetes, senile diabetes, affecting almost everybody sooner or later, except a few privileged persons, is my dream. Because to cure diabetes, to prevent diabetes would mean to prevent all kinds of diseases. Because diabetes is a disaster, is a catastrophe, it's not a disease. Practically, your inability to burn what you eat, and therefore you will have a classical increase of glucose, progressive in the blood, or I am not talking about insulin-dependent diabetes. This also could be cured in different ways, in a radical way, but I would focus on senile diabetes. So alteration of the metabolism, so decrease of capacity to metabolize, to produce energy through sugar. You know, the classical Krebs cycle. If you don't produce ATP and you don't produce energy, you don't burn your sugar, it will increase in the blood. So this is a key for understanding or preventing aging, aging-related diseases also. So my first worry was to see whether TRH can really correct sugar metabolism in the aging population or not aging population. It does.
Yes.
It does, definitely.
Yes.
I had experience through many years with patients affected by this kind of these metabolic diseases, which is a key for everything. So, because if you don't burn your sugar, you are going to develop all kinds of diseases, because it affects immunity, it enhances, so it could affect cancer, onset of cancer, all kinds of diseases, especially also, let us say, what has to do senile diabetes with autoimmune diseases. But obviously, because if hormones are affected by the fact that you don't produce energy, and you alter also the the metabolism, glucose metabolism, and also your hormonal pathway, obviously immunity will be affected. Immunity, what mean? You are going to develop diseases of all kind, autoimmune diseases and cancer, which is due to lack of immunological control of yourself. And that's how cancer cells multiply. They are there. So I think if we focus on the capacity of TRH to modify and to control glucose metabolism and the level of your sugar in your blood, we have won a gigantic battle, because we go back to the key of these metabolic diseases, alteration and aging of your capacity to keep your body going, and diabetes.
Yes.
And diabetes.
Yes.
Diabetes is expression of aging.
Yes. Yes.
And therefore, type 2 diabetes is a key element in the story of TRH. If we can modify the glucose metabolism with TRH, we can. We can in the most radical way, and you can easily check it by making blood tests.
Yes, of
easy.
course.
In the pharmacy, in the laboratory,
Yes.
Even at home. Would
good,
be
yes.
very easy then to
Yes.
have at home the kit where you can make your own evaluation.
Yes, yes.
So I
Yes.
think really that the key for understanding also the mechanism of action of TRH, the dosage of TRH, is to study your own glucose metabolism, to have the glycemia in your blood in
Yes.
the morning, fasting,
Yes.
and you have the answer.
Yes.
Very easy answer,
Yes.
definitive answer, whether or not TRH can help you not to age and not to develop
Dr. Pierpaoli, and,
senile diabetes, which
we'll
is
go on to
linked to
discuss
the
some other
basic
pathologies
pathology
as well. So thank you
of
very much
aging.
for informing us about diabetes.
This
That's-
metabolism.
That's fascinating, Dr. Pierpaoli, and we'll go on to discuss some other pathologies as well. So thank you very much for informing us about diabetes.
So, Dr. Pierpaoli, my goodness, that I see that diabetes link with TRH can go in so many directions, and I understand that that's a very key part of your answer. But perhaps if we could, for people out there with specific problems, would you like to comment a little bit? You mentioned autoimmunity. Would you like to say a few words about some of the autoimmune problems you've seen in your patients and what's happened when they've been treated with TRH, please?
Yes, I started to be busy with autoimmune diseases, and of course, what they are not maybe known as autoimmune diseases, neurodegenerative diseases. 15 years ago, when a lady came to me in Roma, almost crippled or desperate, and still now is there. And of course, this is multiple sclerosis. The diseases which kept me busy for many years are mainly called, there are different names, the same origin. I wrote an article and published about the cause, origin, and maintenance of autoimmune diseases. They have different names, but the same etiology, the same origin. Among the ones I was busy with is multiple sclerosis first, Parkinson, and also amyotrophic lateral sclerosis, which is the worst of all of them. And not last, I would say, if you allow me to say, the famous Alzheimer, because my view, Alzheimer is not at all what I talk about. It's something very different and much simpler.
Yes.
Is brain sclerosis.
Right.
So I have had through the many years patients being treated by me for multiple sclerosis, healed, cured, healthy, and of course with some small motor deficit, but altogether they feel alive. I am well, I am cured.
Wonderful.
And then a lot of Parkinson. Parkinson, what is? Parkinson, I discovered, for example, that many cases of Parkinson is due to a blow on the head. Many had a car accident, you know why. And then I discovered that, in fact, Parkinson is not a neural disease, it's a vascular disease of the area of the brain where the blood supply is deficient, is missing, and then of course the poor neuron will asphyxiate and die out. And what you have to do is to provide blood supply and not to give drugs, because drugs kill the neurons and make them sleepy forever.
Incredible.
You remember the story of a pope in Roma?
Yes.
Typical. Yes, more drugs, and he died. You have to do the opposite. So in my view, autoimmune disease, multiple sclerosis, Parkinson, SLA, and Alzheimer, they are vascular disease. Okay, it is so that the origin of autoimmune disease is a viral infection. A viral infection leads to a sequence of events which generates autoantigen, autoimmune disease, and the process takes place. And then you have plaques, you have this progress, this area of the brain affected. Of course, in the case of multiple sclerosis, they are in the brain, and you know these plaques, and they are generated by viral infection, and then they are maintained, especially are maintained by drugs. So my way is to go the opposite way. And concerning TRH, I have been using TRH, of course, and still some of the patients originally affected multiple sclerosis started many years ago. I was giving, producing, so homemade, something legal, but with my prescription. Of course, I do it with prescription, medical prescription. And I saw incredible effect. Why? Because TRH affects immunity. How does TRH affect immunity? Frankly, I don't know in detail. But in my view is promoting the hormonal control of immunity, because not one single immunocyte or lymphocyte will move without instruction from where? From the neuroendocrine system, from the hormonal system. They are totally dependent. So immunity depends on our hormonal cyclicity. TRH, by enhancing, normalizing rapidly the immune system directly, as I saw in my first work in '89, in antiviral activity. Magically, TRH acts directly and also by restoring the hormonal control of immunity. If you don't do that, you cannot even dream of restoring immunity, because autoimmune diseases which generate the neurodegenerative diseases are not cured if you give drugs. They are maintained and made worse. So you have to rebuild the immunity. And to rebuild the immunity, you have to rebuild the hormonal control of immunity. And that is why TRH acts directly and also by restoring the hormonal capacity of the body to control immunity. So it is a circle, and you break the vicious circle generated by infection, and then start the autoimmune process, autoantibody, and so on and so on, by restoring immunity. TRH magically is able to powerfully restore the control of immunity, and that is a way to cure definitely autoimmune disease. Parkinson, mainly, I have many Parkinson patients happily thriving with with the restoration of their capacity. I mean, you understand that I saw very clear. Autoimmune diseases, if you start with the first symptoms, Parkinson, multiple sclerosis, start deficit, motor deficit, or trembling, the right leg, they are cured. They are cured totally. What you don't have to do is to wait, because it will be more difficult with time. I am taking care of patients after 10-year Parkinson, 20-year Parkinson, taking levodopa. Of course, you can restore their health, their capacity, motor capacity, but you can, to a large extent, help them to feel better, to keep better, not to get worse, because that is the aim when you see a Parkinson after 20 years. suffering, taking drugs, levodopa, all kind of this kind of drugs.
Yes.
Obviously, you cannot expect to cure him, but you can stop the progression of the disease and help him to have a decent life.
Right.
So he's Parkinson, so he's multiple sclerosis, and I am working with Alzheimer patient, being dementia, older man, older woman in the family, terrible situation, and you can really restore to a large extent the capacity to be autonomous, to smile to the children, to recognize them, to remember their name. You know, this is easy to verify.
That's very interesting, Dr. Pierpaoli, and also reminds us, of course, very important point, that one should start doing a treatment program as early as possible.
As early as
not
possible.
to wait too long, of
No,
course.
immediately. I know. I receive letters from a patient with initial Parkinson saying, "Doctor, I feel so well. I'm again going on bicycle." This is the answer I
Wonderful.
expect. But you have to intervene immediately.
That's wonderful.
You don't wait, no drugs.
Yes.
No, it doesn't work.
Yes. And you put that in such a human way as well, because that's what it's about for people, to go about their normal lives in a nice capacity, whether it's cycling or whatever it might be you enjoy. That's fantastic.
Yeah, it's a great joy for me to see
Yes,
this.
naturally.
Numberless patients brought back to life, really.
Yes,
I
indeed.
have the evidence,
Indeed.
no doubt. And TRH is a very powerful element in speeding up the restoration of immunity, the restoration of vitality, the restoration of metabolic pathway, and which can be easily seen by the same patient at home by
Indeed.
making the test.
Indeed. We shall talk more about that, Dr. Pierpaoli, in another question. Thank you so much.
You're welcome.